Greetings, everyone, and welcome to our weekly podcast of the future of vascular health. This week, since it's Heart Health Month again, still, we're going to focus on heart health, and particularly, we're going to talk about the how glycocalyx is related, and the breakdown of the glycocalyx starts this whole inflammatory response that ultimately leads to bad outcomes. And so, in the interest of time, I'm going to turn it over to Dr. Hans Vink, our special guest today, and he'll go through the physiology and explain exactly what's happening in our bodies as we age and this disease progresses. And then he'll also talk about why is glycocalyx important, and most importantly, what can we do about it?
Well, thank you, Bob. Today, as you mentioned, I would like to talk a little bit more about atherosclerosis, what it is, and how it can result in a heart attack, and how glycocalyx is involved in that process. So usually, when we talk about glycocalyx, we're mostly focused on the microvasculature, all the small vessels that take the nutrients in the organs, and then glycocalyx breaks down and the microvasculature is damaged, causing organ starvation. But today, when we start talking about atherosclerosis, we will go back to the large vessels, specifically the arteries that take the blood from the heart to the organs, because atherosclerosis is a macrovascular disease. More specifically, atherosclerosis is narrowing or occlusion of the large arteries. So when that happens, when an artery is shut down or closed by atherosclerosis, it's difficult or impossible to take the blood to an organ, and an organ will be damaged. So to understand a little bit more what atherosclerosis is, I'll show you this little scheme. So on the left-hand side, you have a healthy artery with blood flowing in the lumen of the vessel. And then when cholesterol starts accumulating in the vessel wall, so below the endothelium, cholesterol will leak into the vessel wall, either causing what we call a fatty streak, so some cholesterol with a lot of inflammatory cell called macrophages trying to get rid of the cholesterol, so fat laden macrophages, or atheroma, which a lot more cholesterol on top of the macrophages, causing a bulge in the vessel, moving inwards, narrowing the lumen where the blood can flow. But either when this plaque ruptures and the cholesterol leaks into the vessel lumen, or when the endothelial lining that covers the cholesterol starts wearing down and blood starts clotting, it can lead to a complete blockage of the artery that takes the blood to the organs. So when this complete blockage by either a blood clot or cholesterol completely filling the lumen, and blood can no longer flow through the artery towards the organ, well, if that happens in the arteries taking blood to the heart, we get a heart attack. So the large arteries taking oxygen and nutrients to the heart is closed, no more oxygen to the heart, and the heart is damaged and get a heart attack. It can also happen in different arteries, like in the carotid arteries that go to the brain. If a big blood clot forms in such a vessel, and it can cause a stroke. And in addition, if something like this happens in the large arteries supplying blood to the legs, or your legs will no longer get blood flow, and you might have to get an amputation. But if it happens in the heart, we call it a heart attack. Now, what most people don't even know is that quite a few people can have a blockage without getting a heart attack. And this is illustrated in this scheme here. So again, if you have a large artery, for instance, in the heart, taking blood to one side of the heart and another artery taking to another side of the heart, and if this large vessel here near the branching point, if there's a stenosis that develops and start slowly closing the lumen of this vessel and shutting down the blood flow of this part of the heart, quite a few people where that happens will never notice. And the reason why is that everybody has what we call pre-existing collateral vessels, which are natural bypasses that can take the blood from the healthy artery to the side of the heart where blood flow is impaired because of the atherosclerosis. Well, in order to do that, when this blockage occurs, and when it happens, blood will start flowing through these really tiny pre-existing collaterals. And in many people, but not all, as soon as blood starts flowing through these pre-existing collaterals, these vessels will respond, become bigger, and will act as natural bypasses, taking enough blood to this side of the heart, and the heart will never notice that there's a blockage in one of its arteries. But not everybody is so lucky that that happens. So how is glycocalyx involved? So one thing that we realized is if you look at people with a compromised glycocalyx, and those are on the lower left here with a PBR value that's bigger than 2.1 microns, in a study that we did in 600 healthy individuals, it shows if your PBR or your level of glycocalyx damage is greater than that 2.1 microns, and you look at the risk of getting a heart attack or a stroke, then we see if your glycocalyx is compromised, your risk of a stroke or a heart attack is more than 5 times greater than in individuals with a healthy glycocalyx. Now, to put this in perspective, if you compare that by knowing that you're diabetic or that you have a family history of heart attacks, or are you using medication against hypertension or medication to lower cholesterol, having a compromised glycocalyx is a much better predictor than all these other risk factors combined, whether you get a heart attack. And even if you compensate for all these other risk factors, so you only look at people that don't have diabetes, no family history of heart disease, or using hypertensive drugs or cholesterol-lowering drugs, then on top of that, just having a compromised glycocalyx adds another 30% risk. So 30% of people that we will not be able to identify because of the classical risk factors can be identified by measuring the health of their glycocalyx. So now the question is, how is glycocalyx involved?
So Hans, on this study, I think it's important to share. This study was over 6 years. Give the results of the people that we predicted 6 years in advance of the events that actually happened in real time.
Yeah, so there were 600 people measured more than 6 years ago. They're all healthy and then just classified based on their level of glycocalyx damage. And then they did 6 years of follow-up to see which of these people would get a heart attack or a stroke or would die because of cardiovascular disease. And it turned out that almost all of the people getting a heart attack or stroke were in the group of a compromised glycocalyx. So there's a huge risk of getting these cardiovascular events when your glycocalyx is compromised.
Right, thanks.
So now we want to know, how is glycocalyx involved? How does it lead to increased risk of atherosclerosis and a heart attack? So what we do know, if we look at the sites in these large arteries where the atherosclerosis starts developing, it's well known where these happen. Those are large branching points of bifurcating arteries. And there's really small sites where the cholesterol will always start leaking and the inflammatory cells will start moving into the wall. And if we look at these sites and we measure the thickness of glycocalyx, we know that at these sites where it all starts to happen, glycocalyx is much thinner than downstream in the same vessel or even at the opposite side of these large arteries. So these are very well-defined sites where glycocalyx is very thin, and those are the sites where the atherosclerosis will start. Well, the reason that these sites or that the atherosclerosis will start at sites of a thin glycocalyx can be illustrated by this cartoon showing why glycocalyx is important to protect the vessel against atherosclerosis. This is a healthy vessel with a healthy glycocalyx. And one of the important properties of a healthy glycocalyx is that it prevents leakage of large plasma molecules, large proteins, or even cholesterol, which is a huge molecule, to leak over the endothelium in the vessel wall. So, size of a thick glycocalyx, there will be no cholesterol leaking into the vessel wall. At the same time, for the immune cells, the leukocytes and the macrophages, to enter the side of the vessel where the cholesterol is accumulating, they need to attach to the endothelium and crawl into the vessel wall. And be part of the inflammatory process, but that doesn't happen as long as glycocalyx is thick and protective. And only at sites where glycocalyx is compromised, will have significant leakage of cholesterol into the vessel wall and blood platelets to start triggering blood clots or immune cells being part of the inflammatory process at these sites. So to further understand why these lesions and why glycocalyx is small at these predefined sites at artery bifurcations, it's helpful to look at how blood flows over these bifurcations. So again, this is a model of a carotid artery bifurcation. It shows at the site where the artery splits into branches, and you look at the motion of the blood. So the red color is forward motion, the blue color is backward motion. You see at these sites, just downstream of the branching point, you see that the blood flow is very complex. There's some blood is even circulating, and at these sites here where you see the blue color, there's hardly any motion forward of blood flowing over the vessel wall, and the endothelium doesn't feel any shear forces of the blood moving forward. That's different than the rest of the vasculature. Everywhere else is the blood is constantly moving forward, except for these locations very close to the branching points. And these are exactly the sites where glycocalyx is very thin. And we now know that's because of the lack of shear forces, because we can simulate those sites near branching points by culturing endothelial cells in a flow chamber. Now close the chamber, we can look in the opening how glycocalyx is doing, and we can control blood flow at different flow levels, so normal flow levels or medium or very low flow levels, like at these complex flow pattern sites. So when we do that, we see that if you measure the level of glycocalyx production and normal levels of blood flow, we have normal levels of glycocalyx production. But when blood flow is reduced, or even when blood flow is very low or recirculating, there's very little, if any, production of glycocalyx, explaining why these sites are so vulnerable and don't have glycocalyx to protect the endothelium against leakage of cholesterol and leukocyte migration into the vessel wall. Well, another study done by the group of Fisher et al. In 2010 already, they also confirmed if you reduce or impair the production of components of glycocalyx, and in this study they inhibited the production of hyaluronan, an important polysaccharide of glycocalyx, with a drug called 4-MU. So they looked, for instance, at the aorta, the big artery from the heart to the organs, and also at the aortic root in the center, over time, what happens with plaque formation. So they compared the vessels from healthy animals with blocked hyaluronan synthesis, and the first 8 weeks, 15 weeks, and 25 weeks. And if you measure the size of the plaques forming in the aorta, you see there's a significant increase when you block the production of hyaluronan. So less glycocalyx means more atherosclerosis. The same for the aortic root, the beginning of the aorta near the heart. If you look at the plaque size, there's a significant increase in plaque size when glycocalyx production is impaired, consistent with the other images that we already showed. So if you look at those sites where glycocalyx is broken down or impaired in terms of cholesterol leakage, we see what's shown on this slide. On the left-hand side is a healthy vessel with a thick glycocalyx. Blood is flowing on top in the black area, and we injected green labeled LDL cholesterol to see if the cholesterol can leak into the vessel wall and start causing atherosclerosis. Now at sites with a thick glycocalyx, all the cholesterol is stuck in glycocalyx, and the blue dot is the endothelium, so where the vessel wall starts. So none of the cholesterol actually leaks into the vessel wall or passes the endothelium. In contrast, a little bit downstream at those sites of recirculation and impaired glycocalyx synthesis, already within a few minutes, a lot of the green labeled LDL cholesterol leaks over glycocalyx in between the endothelial cells and start accumulating in the subendothelial compartment in the vessel wall, triggering a local inflammatory response. Well, for the next step in inflammatory
Can
response.
I stop you there one sec, Hans, and just ask you a
Sure.
question? So based on what you're showing, if a person has a healthy, thick, systemic glycocalyx, the impact of cholesterol is minimal because it can't go and do the damage that you've just illustrated up to now happens. Is that correct?
That's correct. If your overall glycocalyx health is good, then also at these sites, at bifurcations, even where glycocalyx is thinner than in the rest of the vasculature, it's still in a good enough shape to protect that site against cholesterol leakage. But if your overall glycocalyx starts, decreasing and is impaired, then these sites near the bifurcation areas where glycocalyx is already thinner than in the rest of the body, those sites will break down first and become highly leaky, and that's where cholesterol will start leaking into the vessel wall.
Right. So that's why when I explain what we do to people, we focus on the artery wall or the vessel wall and what's causing the problem in the first place. So we're not focused on thinning the blood or lowering the uh, glucose or lowering the amount of cholesterol. What we're focused on is strengthening the natural protective barrier of the glycocalyx, which is systemic from the smallest capillaries all the way up to the largest arteries. Is that correct?
That's correct. So we are helping, supporting the natural protection of the vessel wall against all these challenges. So, regardless, the level of cholesterol or glucose or other uh, vessel damaging toxins in the blood, as long as your glycocalyx is in good shape, you're well protected against those challenges.
All right. Thanks for clarifying that.
Well, and in addition to the cholesterol leaking at sites of compromised glycocalyx, we also see that leukocytes, the inflammatory cells, will stick to the endothelium and migrate into the vessel wall when glycocalyx is compromised. So this is a study that we did looking at small vessels that we can impale with a glass micropipette, then flush out the blood every few seconds with either a regular saline solution or another solution with enzymes that we can break down glycocalyx. And each time we flush out the blood, you see these bigger cells, almost transparent, that move very slowly over the vessel wall. Well, those are the leukocytes, the inflammatory cells that slowly roll over the vessel wall to control and check whether there's a site of damage or inflammation. And if there's any site that is damaged, they will stop rolling, they will stick to the endothelium, and they will crawl through the wall into the tissue or into the vascular wall to start dealing with the local damage and inflammation. Yes, that's a body's natural repair system. So the leukocytes will just check and roll over the endothelium, and they can do that in the presence of a healthy glycocalyx. So the leukocytes have actually fingers sticking out, called microvilli, that are the same size, a little bit longer than the size of glycocalyx. And on the tip of these microvilli, they have these rolling adhesion molecules. So they can roll over glycocalyx, they can put their fingers through and scan the surface of the endothelium to see if there's any damage, and they can adhere to their rolling adhesion molecules and slowly roll. But they won't stop, they won't stick to the wall unless the whole body of the leukocyte can stick to the endothelium, which cannot happen in the presence of a healthy glycocalyx. So when glycocalyx breaks down, we see a significant increase in the number of leukocytes or inflammatory cells sticking to the vessel wall and to the endothelium. So these are two examples. On the vertical axis, it shows the number of leukocytes sticking to the wall, being part of the local inflammatory response. The blue data points are control numbers, so very low sticking of leukocytes under control situations. And as soon as there's damage to glycocalyx, this time the damage was caused by high levels of oxidized LDL cholesterol, then there's a significant increase of sticking of leukocytes to the vessel wall and contributing to the local inflammation. Similarly, on the right-hand side, if we microperfuse the vessel with specific enzymes that break down glycocalyx, like heparinase that breaks down the heparin sulfate glycosaminoglycans, break down your glycocalyx, then the endothelium, the vessel wall becomes very sticky, and a lot of the leukocytes will stick to the wall and contribute to the inflammatory response in atherosclerosis.
So if I might pause you here, when I first started reading these papers that you had published and the experiments that you had done, Um, this is exactly what led me to the premise that if we could find the natural sources to build and restore glycocalyx, then we could potentially reverse this process by giving the body what it needed in terms of natural nutrients to restore the glycocalyx, which then would reverse this process.
Well, you're absolutely right, Bob. And in a couple of slides, I will show you some of the original data that we collected. Then, as soon as you have damaged glycocalyx and you provide the tissue with the natural substrate for glycocalyx that you can find in some of the foods and some of the seaweeds that you have been looking for, then you can almost instantly rebuild your glycocalyx and prevent even activated leukocytes from sticking to the wall and contributing to the atherosclerosis. Uh,
So I guess the good news in what you just said, and I guess this is what struck me so much when I started working with you, is, mostly when this starts to happen, you get bad news. It's just going to be progressive. But the good news is that the body really does want to heal itself. And if you give it the capability, it will.
Absolutely correct, Bob. So that's what we're trying to do. Um, so what I want to focus also on is we've shown that glycocalyx is compromised, and especially that happens at these sites of bifurcations of large arteries. Two of the important consequences are the cholesterol will start leaking into the wall, and inflammatory cells will also start leaking into the wall, causing local inflammation and plaque formation that can actually close down the artery. What I also talked about a little bit in the beginning, that even when that happens, even if you look at this artery on top, one of the two arteries from a branching point, for instance, in the heart, even when that starts happening and the cholesterol starts building in the vessel wall, leaking across glycocalyx, leaking into the vessel wall, and a lot of inflammatory cells will also start accumulating at that site, causing atherosclerosis and at some point shutdown of the blood flow in this artery. In quite a few people, this happens without ever realizing it. And the reason that they don't realize it is that even before this starts to happen, there are what we call pre-existing collateral arterioles, which are natural bypasses that can take blood from one artery to the tissue area that's perfused by a second artery whenever this artery is closed and shut down. But under resting conditions, in the absence of any significant occlusion, these pre-existing collateral arterioles are very small, and there's no significant amount of blood flowing through these arterioles. However, when this larger branch of artery is shut down and closed, and no more blood is flowing here, then the amount of blood flowing through these pre-existing natural bypasses will start increasing. Um, and if you have a relatively healthy vascular wall and healthy endothelium, then these increased levels of blood flow will be sensed by your endothelium. And I'll show you in a second how crucial the glycocalyx is to be able to sense that increase in blood flow when there's an occlusion in one of the arterial branches. So when the increased blood flow is sensed by these small arterioles, then they will change their shape. They will become much bigger, they will widen, and they will become really significant collateral arteries again with big lumens that can facilitate a lot of blood flow. And when that natural process happens, it can completely compensate for the lack of flow through the occluded artery, and these bypasses will provide blood flow to the downstream tissue and will prevent you from getting a heart attack. But not everybody that has these pre-existing collateral arteries will respond in this way and allow for natural bypasses to compensate for that lack of blood flow.
Well, just a question. So theoretically, if a person was able to strengthen their systemic glycocalyx, it would increase potentially the ability to make those pre-existing collateral arterioles become effective again.
Yes, and the key in understanding and to understand how glycocalyx is involved is in this middle panel where it says increased shear stress. So only when this is occluded, blood will start flowing through these small pre-existing collaterals. But these are really small. There's very little amount of blood flowing initially. But when the endothelium senses the shear stress, and for that you need a glycocalyx, then those vessels will remodel, as we call it, become big arteries and bring sufficient blood flow from the other artery with normal blood flow to the site that's compromised. But you need a healthy endothelium with a healthy glycocalyx that can sense the shear stress and start responding by producing, for instance, nitric oxide. So
Right.
that's also shown again in this cartoon. So one part of the function of glycocalyx is shown here on the lower left. So these polysaccharides of glycocalyx, when blood is flowing from left to right, they will bend forward, and because of the lever function they have, they will significantly amplify what we call the shearing forces of the blood to the endothelium. So
So
the
it's really going like
glycocalyx,
this. When the blood, and this is my endothelium, when the blood flows, it's a lever and it's signaling the endothelium, and that's how that whole natural process happens.
that's correct, Bob. And the estimates are that in the presence of glycocalyx, those shear forces are amplified approximately 100-fold
Wow.
to really wake up the endothelium to start producing nitric oxide. So that's shown here. So these polysaccharides will bend forward. They will cause a significant force transmitted to the endothelium, which will activate the enzymes in the endothelium called nitric oxide synthase to produce more nitric oxide and to start increasing not only blood flow but also remodeling these pre-existing collaterals to make them full functional natural bypasses.
So
And
this
then
is a
aside,
really important part of our, I guess, so what do we do about it and the therapeutic that we've designed. So when we get to the end, we'll talk a little bit about
yeah,
why that's so
so
important.
that's correct, Bob. So in the absence of a healthy glycocalyx, well, it doesn't matter how fast the blood is flowing over the endothelium, but the endothelium doesn't sense it, doesn't feel it. It needs a glycocalyx to tell the endothelium, well, something has changed. The blood flow in these pre-existing small vessels is increasing. Something must happen, but it needs glycocalyx to tell the endothelium and the rest of the vessel to remodel.
So let me ask you another question, if I might, because now that we understand how nitric oxide is produced in the vascular system, and then if the glycocalyx is gone, as you know, there's a lot of focus on nitric oxide and different supplements that talk about it. Um, is it safe to say, unless they're focused on increasing the glycocalyx, the effect of those is going to be fairly minimal because it's just going to keep whatever they're doing is just flowing through the blood anyway?
Yeah, it's more than just the nitric oxide levels. You need like a mechanism to communicate with your endothelial cells and the rest of your vessel wall that something is changing. So it's a sensor that senses the changes in blood flow, telling the vessel wall something is happening. And in addition to nitric oxide production, a lot of other chemical pathways are triggered in the endothelium. By doing so, that triggers the whole process of remodeling. So it's not just as simple by adding a little bit of nitric oxide that will solve your issue. You have to repair your glycocalyx as a signaling mechanism to your vessel wall that things are changing in the bloodstream.
All right, thanks for clarifying that.
So a few examples, what happens to your nitric oxide production in response to shear stress when your glycocalyx is compromised. Here we show in the open circles in a large artery when blood flow increases and shear stresses increase. In the presence of a normal thick glycocalyx, there is a proportional increase in the levels of nitric oxide production by the endothelium. If you take off glycocalyx or it's compromised at sites at the bifurcation areas or in people of high risk, for instance, with diabetes with a compromised glycocalyx. So if you don't have a healthy glycocalyx, you can increase your blood flow significantly, but there's hardly any impact on the level of nitric oxide produced by these endothelial cells because they need glycocalyx to sense these increases in blood flow and to start producing more nitric oxide. It
So,
doesn't mean, sure, go ahead, Bob.
so I was going to ask you then, so a lot of people focus on devices that increase the blood flow, but just increasing the blood flow, if you haven't solved this problem that we're explaining here, it's just going through the body faster. Is that True?
Yeah, so even at high levels of blood flow, if there's no glycocalyx on the endothelium doesn't respond to those increases in blood flow.
Okay.
And it
Thanks.
doesn't mean that the endothelium cannot produce nitric oxide. So this shows in response to drugs like acetylcholine that stimulate the endothelium in the presence or in the absence of glycocalyx. If you give the drug, it can still produce nitric oxide. But it's unable, the endothelium, to produce nitric oxide in response to blood flow changes and trigger other signals in the vessel wall in response to those increased shear forces. For that, you really need a healthy glycocalyx. Um, well, there's another example of a similar experiment. People cultured endothelial cells and exposed them to increased shear forces. Then again measured the level of nitric oxide. And the top curve is the increased accumulative amount of nitric oxide being produced over time. And when you have healthy endothelial cells with a glycocalyx, so these are control endothelial cells exposed to what we call 20 dynes per square centimeter of shear stress. Well, healthy endothelial cells without shear stress produce very little nitric oxide. And if you take off your glycocalyx and you expose the cells to shear stress, so the little stars here, again, similar level of shear stress, but after exposure to enzymes like heparintenase to break down your glycocalyx, you see there's hardly any production again, other than the normal resting levels of nitric oxide production, but no shear stress responses. And again, these cells without glycocalyx can still produce nitric oxide if you expose them to a chemical agonist, like in this case bradykinin, which is another drug that you can use to tell the endothelium to produce more nitric oxide. Same story. If you take off glycocalyx, there's no shear stress induced nitric oxide production. Well, there's a few other functional changes in endothelium when you have a glycocalyx that senses shear stress. One of them is that the endothelial cells will change their shape and their orientation in the vessel and their functional behavior when they can sense shear stress. So in this experiment, they cultured endothelial cells in the Petri dish, and this is a low magnification look from above on all those endothelial cells. If you can tell, each little dot is one endothelial cell, and if you start culturing them, they will grow in all different directions, from left to right, from the bottom to the top. So there's a random order in which they organize in the vessel lining. And that's at the start. But if they have a glycocalyx and you start flowing blood over the endothelium from left to right, then within hours, all the cells will sense the shear stress. They will orient themselves in the direction of the shear stress, and they will completely change the way they behave. And that's also shown in the graph on the bottom that shows the angle between the blood flow from left to right and the position of the endothelial cells. So at start, you see that there's a random orientation of the cells. You have angles between 0 degrees and 90 degrees between the direction of the endothelial cells and the blood flow. But if they can sense blood flow with a healthy glycocalyx, after 24 hours, you have only very small angles between the endothelial cells and the blood flow. So they will change their orientation and the way they will act in response to all kinds of different stimuli. Well, in contrast, if you take off glycocalyx, again using enzymes like heparintenase, even after 24 hours of flow, they still are randomly oriented. They don't know anything is happening on their surface. There's no nitric oxide production. There's no signaling that tells the endothelial cells to behave differently. The same as the lack of collateral blood vessel formation, for instance. Another example showing collateralization, or the growth of the natural bypasses, is shown in another experiment done by the group of Fisher more recently in 2021. This is a model in small animals that they occluded the left or right paw, and in this case they occluded the arterial blood flow in the left paw. And look in healthy mice compared to mice that had an impaired production of glycocalyx. This is a so-called hyaluronan synthase knockout model that cannot produce hyaluronan and has an impaired glycocalyx production. So if you focus on the middle part, on the left-hand side here, that's the side where the artery perfusing blood into the left paw was occluded. You see a lot of new vessels are formed and bypassing the occluded artery and restoring blood flow into the left paw, even though the main artery is almost completely occluded. On the right-hand side, in the absence of normal hyaluronan production, so less glycocalyx, there's significantly less collateralization and less formation of those natural bypasses that I referred to in the earlier slides. And if you look at the level of blood flow, you see that the top bar over time, days after the surgery, after the occlusion of the main artery, there's significant repair of blood flow in the healthy animals with the healthy glycocalyx, and there's a significant reduction of natural bypass formation in the animals that had a compromised glycocalyx. And the same is shown on the top panel here. It shows the collateral blood volume. So the blood volume in the collateral vessels is significantly higher in the healthy animals with the healthy glycocalyx. And when you compromise glycocalyx, that shear sensing is impaired, like I told you before, and there's less development of your natural bypasses. So when all that's happened, if you have a compromised glycocalyx leading to more cholesterol leakage in the branching point or more inflammatory cells contributing to the atherosclerosis and an impaired natural bypass formation, hopefully we can reverse some of those processes when we repair a glycocalyx. And this is where Revasca can be of significant help, really restoring the normal levels of nitric oxide production, for instance, and also helping to prevent the adhesion of the inflammatory cells and really lowering the level of inflammation that's such a significant part of the atherosclerosis. So a few more slides to show the effect of Revasca. Some of these data you might have seen before. This is in an aging model in mice, showing that young mice have high levels of nitric oxide production and is significantly reduced with aging because of an impairment of their glycocalyx. And in the study that we did with Dan Mashin, we showed clearly that 8 weeks of taking the Revasca supplement in older mice almost completely normalizes their levels of nitric oxide production again. So by repairing your glycocalyx, you again have normal levels of shear stress-induced nitric oxide. Well, another experiment that we did, Bob, that you already alluded to, is that if your glycocalyx is damaged and you provide natural replacement of glycocalyx ingredients like the polysaccharides in the different seaweeds that you have been investigating. So if you inject those, and this is the new glycocalyx dietary supplements labeled with a dye injected into this small vessel that had a compromised glycocalyx. And you see by injecting it on the left-hand side of the vessel, it flows with the blood, and only the left side of the vessel is exposed to the dietary supplement. But then a few minutes later, if you look at the same vessel, you see there is a bright lining of new glycocalyx on the inside of the vessel on the left-hand side. And if you zoom in a little bit, you can see there's a significant thick glycocalyx of a couple of microns thick that you can rebuild by supplying natural ingredients like the fucoidin that's in our Revasca supplement, and is very well able to repair a damaged glycocalyx and offer new protection against leukocyte adhesion and leakage of cholesterol, and stimulates a new production of nitric oxide by repairing glycocalyx. So with that, Bob, I want to thank our audience for listening and give the word back to you.
Well, thank you very much, Hans. I think that's very enlightening for our audience. And so hopefully they now better understand what leads to the progression of the breakdown of your glycocalyx, which then leads to the inflammation, which then leads to the ability for the cholesterol and other items to accumulate, go under the endothelium and create those bulges. And then also it reemphasizes the importance of the nitric oxide, which we talked about some last week, and its importance in the role of helping maintain a healthy blood pressure level. So next week, what we want to talk about is really something that's near and dear to my heart, literally. And that's what sent me on this journey. And that's, I guess, microvascular dysfunction in the heart. and really the differences between men and women and how they experience heart attacks and the progression of heart disease in the two audiences. So we'll talk about that, and we'll talk about what we know, and then we'll talk about what leads to what's known as Syndrome X, but we've got some studies on that. So we look forward to talking to you next week, and have a good week. Thanks.
Thank you, Bob. See you soon.
Thanks for listening to The Future of Vascular Health. Healthy vessels, healthy future. If you're ready to take charge of your health, it's time to check out Revasca. This powerful supplement is designed to protect your glycocalyx, the microscopic layer that keeps your blood vessels healthy and strong. Revasca can help support your heart health, improve circulation, and even reduce high blood pressure. It's also great for boosting brain function, keeping your kidneys healthy, and preventing vascular complications before they start. Think of it as a way to keep your body running smoothly so you can live longer, feel sharper, and stay active. Don't wait. Take the first step toward better health today. Visit glycocalyx.com to learn more about Revasca and how it can help you protect your future.